Never has there been a time that we needed to pray for healthcare as right now. So how do we do this? Well, you can do it. If you're a Christian, you have the hands of Christ. You have the love of God in your heart, and you have the power of the Holy Spirit moving through you. And you can reach out, you can achieve much. But you can achieve so much more if we work together as the body of Christ. The poet Robert Browning said, and I read this 2 weeks ago and I knew it was important. I'd never seen it before, but as soon as I saw it, I know this is important, and I wrote it down. He said many years ago that a man's reach must extend beyond his grasp. That a man or a woman, and woman there, reach must extend beyond their grasp. So what do you grasp? You grasp the things you can handle. Grasp the things that you can deal with. You grasp the things that you are capable of doing with a closed hand. But when you reach out, you do so with an open hand that only God can fill. And when you reach out to people in prayer, in health, or in any other matter, you can achieve so much more. So we are the body of Christ. We can achieve so much more, even together, in praying like this. When 2 or 3 are gathered together, we know that. We can achieve so much more when we pray in this way. So what are we going to pray for? We're going to pray for patience. We're going to pray for the dying. How do you pray for the dying? Well, you pray for peace, and you pray for healing, because you don't know until it actually happens that that patient has died. And I know that the person himself will probably have a feeling and know about it, but you pray for peace and you pray for healing. And there are 3 things you can pray for a dying patient beyond that. They're important. Remember these, because they work and they are vital. The first thing you pray for the dying patient is that they will not be abandoned, that they will never feel abandoned, that there will always be someone with them. It's very easy when we go to see somebody in hospital who may be dying to say, oh, I can't go there, I wouldn't know what to say, what can I possibly say? Or this hospital freaks me out, I don't really want to be here. But we should be with them, even if it's just to sit, hold their hand and pray for them. The second thing, they should have a goal. They should have something to aim for. Our friend Terry stayed alive for 6 months so that he could hold in his arms his first grandchild. And that grandchild was born a week ago, and they took him down to Katoomba Hospital where he was able to hug her, and his brother said he's having a real ball. And that was what he was holding out for. And the third thing, and this is really important to pray for the dying patient, is for some way you can improve their lot. Maybe you can give them Panadols and fix their headache. Maybe you can take away their anxiety. Maybe you can put a Band-Aid on their cut toe. It doesn't matter, but if you can help them in some small way, that translates globally to the whole person.